So my name's Cheah. I'm a professor of haematology at Sir Charles Gardner Hospital in Perth, Western Australia. At this ASH, one of the abstracts I'm presenting is Epcoritamab plus R-miniCHOP in patients with diffuse large B-cell lymphoma who have not previously received therapy but are ineligible for full-dose anthracycline. So this was Arm 8 of a large basket trial called NHL2, and this involved patients with the most common type of B-cell lymphoma, diffuse large B-cell lymphoma. The standard of care for younger patients with diffuse large B-cell lymphoma is R-CHOP at full dose. In patients who are elderly or who have significant comorbidities, we use a attenuated regimen called R-miniCHOP, in which the doses of chemotherapy are reduced by approximately 50%. So this is the current standard of care, but unfortunately it's suboptimal. About only 50% of patients are cured using this approach. In this trial, which was a phase 1b/2 study involving 28 patients with diffuse large B-cell lymphoma, we evaluated the combination of the T-cell engaging antibody Epcoritamab in combination with R-miniCHOP in these patients. The study involved 28 patients, as I mentioned, and the Epcoritamab was given as a fixed duration for 8 cycles. The R-miniCHOP was given for 6 cycles as standard, and there was step-up dosing of the Epcoritamab with the combination given initially weekly, then 3 weekly, and the last 2 cycles, which were Epcoritamab alone, were given monthly. The majority of patients on this study were over 75 years of age, and that's why most of them were considered unsuitable for full-dose anthracycline. And most patients had high-risk features such as stage 4, elevated lactate dehydrogenase, and an international prognostic index score of between 3 and 5. The overall response rate in this study was high. It was about 92%, irrespective of high-risk subgroups, and the majority of these patients, about 80 to 82% of patients, attained a complete metabolic response. In terms of the extended follow-up, we are now reporting around 2 years of median observation time on this study, and the progression-free and overall survival rates on this study were excellent and certainly superior to what we, apparently superior to what we see in historic controls of R-miniCHOP alone. There was a difference in terms of the safety profile, and the most common adverse events seen in patients with Epcoritamab treatment is cytokine release syndrome, and that was indeed observed on this study. About 51% of patients experienced CRS, but this was all grade 1 and grade 2. In fact, most of it was grade 1. There was only 1 grade 2 event, so it was fairly straightforward to manage. Neutropenic sepsis was relatively infrequent, and overall the regimen was well tolerated. We are presenting some minimal residual disease data as well, and 21 patients were evaluable for MRD, and the majority of patients attained MRD negativity, most after 3 cycles of therapy, but the rate of MRD negativity increased at cycle 6, day 1. So in summary, the Epcoritamab plus R-miniCHOP regimen is certainly highly effective in patients with treatment-naive diffuse large B-cell lymphoma who are ineligible for conventional dose therapy, and the results justify ongoing exploration.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.